I don't think you need white for the cell phones, do you? Okay. Well, good morning, everyone. I'm Greg Cox, and I'm honored to serve as chair of the Board of Supervisors this year. And I want to thank you all for coming out this morning to be here to help us get some critical public information out about the flu season and about the importance of getting flu shots this year. It goes without saying that 2020 has been a very challenging year for all of us. In this time of COVID-19, we've asked our residents to do a lot of things, a lot of steps to protect themselves and stay healthy, and at the same time protect those around them. We're all familiar now with the 3 messages that we constantly get out. Actually, we could even say 4. Make sure you wear a mask when you're out. Wash your hands. Maintain that social distance of at least 6 feet, and avoid large crowds. I'm here today joined by some county health colleagues to include one more ask on that list. And that ask is to get a flu vaccine shot. Get your entire family to get a flu vaccine shot. Yes, this ask is not new. We do it every year. Flu vaccines are always important to public health and to your individual health. But this year, the importance has never been more important. Last season, 20,711 lab-confirmed flu cases were reported in our region. Tragically, we also had 108 San Diegans die from complications from influenza last year. This year, through October 21st, yesterday, we've had 53,263 San Diegans contract COVID-19. And this year, again, tragically, it's 863 San Diegans have died from COVID-19. We want to avoid the double whammy as much as possible. The chance that somebody could come down with both COVID-19 and influenza. The flu vaccine is safe and effective. We want everyone to get a vaccine as soon as possible, and to do so before the flu season becomes widespread. This year, the county is sponsoring free vaccination clinics throughout the region in October and in early November. 6 clinics will be up and running with vaccines available for adults and children ages 6 months and up. Obviously, the first one is here. We're pleased to see the turnout and the lineup that's already out there to get their flu shot. The next one will be in 2 days in Chula Vista on Saturday, October 24th at the South Public Health Center at 690 Oxford Street. The hours will be the same as today's clinic and all the other upcoming clinics from 10 a.m. to 4 p.m. These vaccine clinics are free, but primarily intended for individuals with no medical insurance, although no one will be turned away. The flu vaccine is also widely available at doctors' offices and retail pharmacies. And as we all know, excuse me, at this point we do not have a vaccine for COVID-19, at least not yet. But we do have one for the flu. So please, let's all take advantage of all we can do to protect ourselves and our family and our friends as we head into this flu season. Now it's my pleasure to introduce Nick Massion, who is our agency director for our Health and Human Services Agency. Nick?
Good morning, and thank you, Chairman Cox. And for the record, Chairman Cox got his flu shot, and so did I. And hopefully today we're going to get many more. We're, on our North Central Live Well campus, where we have our public health center, family resource center, and it's surrounded by our amazing Health and Human Service employees. This is more than just a job; it's a passion of protecting the public health. And as the chairman said, the stakes could not be higher. During this pandemic, the influenza vaccination is extraordinarily important. Not just for some of us, but for all of us. And especially, though, those people who are already at risk or often at higher risk of complications from the flu. These same group of people, and in some cases, communities where these people live, are often at higher risk for COVID-19. So protecting them from influenza is vitally important to decrease their risk for co-infection, the worst possible twin evils of the seasonal flu and COVID-19. And yes, that is possible. That could occur. And so, in addition, we also know, and this is very important, that by reducing the overall impact of these respiratory illnesses, be it the seasonal flu, be it COVID-19, that it's also will lessen the burden in our healthcare system, which is still doing great, but vitally important that we have that capacity, and if in case something were to occur, in an adverse reaction for us. Look, this is an effort, we talk often about that it's up to us. This is a it's up to us movement. It's really all of us, whether taking that first move of complacency, and that means going about and getting and seeking amazing events like the one here today and that are countywide, or getting in touch with your healthcare provider. All seasonal flu vaccines are free in this state, and we all have ways to making sure if anyone has no financial means, like this great event, providing it at no cost, no burdens, no excuses. So we got to break down the complacency, and the confidence in our seasonal flu is an all-time high. You see, 2 years ago we did 900,000 seasonal flu vaccines, influenza vaccinations. Last year, 1.2 million as a region. Can we do 2 million this year? What do you think? I think we can. We got to strive much higher with a population of 3.4 million in San Diego. The other part of this issue of confidence and complacency is this issue of convenience. And that's why we are using a T3 strategy that has been proven amazingly effective in our county of hunting down the virus and protecting the public from COVID-19 and using it for the seasonal flu. And what does that mean? It's going to communities. Communities like right here in Kearney Mesa and the surrounding communities that are using it, and the events that we're going to be doing wide, and the hundreds of community-based organizations, because the county does not do it alone. The county does it in partnership with the community for the community. So we're very excited. We have terrific nurses, and Melissa Thune and Catherine Blazer of our county team leading this great effort with our public health officer, Dr. Wilma Wooten, and our entire county team. And so I'm very excited as agency director to support and see the efforts we're doing. But I really appreciate you, particularly the media, being here and getting the word out and making sure people act, because it's up to us to get the seasonal flu. Now, in that charge of leading the amazing work, the folks that make it painless, our nurses who give you the seasonal flu. We have our chief nurse officer, Dr. Denise Foster, who now will share some words. Dr. Foster.
Thank you, Nick. Good morning and welcome to the kickoff of the County of San Diego annual series of flu events. Each year, Public Health organizes community flu events like this one today. And this year, Chairman Cox and Nick have pointed out that getting the flu vaccine is more important than ever. Last year, we had 20,711 cases of flu in San Diego County with 108 deaths. And in previous 3 years, we averaged 17,073 cases with an average of 176 deaths per year. Each year, flu vaccines nationwide prevent millions of illnesses, thousands of flu-related medical visits, and yes, deaths. While flu activity is quite low right now, with only 10 reported cases in the county, we are starting the flu vaccine in the midst of a pandemic. Preventing flu can help reduce the strain on our medical system that is responding to COVID-19. Flu and COVID-19 are both contagious respiratory illnesses, and while they have very similar symptoms, it may be quite difficult to tell the difference, and testing may be required for true diagnoses. An important difference between COVID-19 and the flu is that we have a vaccine to protect against the flu. So yes, 2020 has been a challenging year. But one thing that doesn't have to be challenging is getting a flu vaccine. Everyone 6 months and older should get one. Today, we are fortunate to have a team of nurses and support staff ready to administer flu vaccines to protect you from the flu. The staff here with us today can provide you information about the flu vaccine and discuss the vaccines for you and your child. People can also get the vaccine, as pointed out, with their healthcare provider, pharmacies, and other clinics, including our public health clinic here. Much goes into planning a flu vaccination pod, as we call them, and as pointed out, Catherine Blazer and Melissa Toon, very much important in setting this up. And I'm proud of the role our nurses overall have played in doing this. As a matter of fact, our nurses are playing important roles far and wide across the county today. Hundreds of nurses and support staff are doing COVID-19 testing. They're working with homeless in the shelters. They're taking part in homeless outreach activities. They're doing case investigations for COVID and other illnesses. They're assisting people who call the COVID-19 nurse helpline, and they are caring for patients in the San Diego County Psychiatric Hospital, the Edgemoor Skilled Nursing Facility, and in the jails. Our nurses are dedicated to partnering with the community to improve the health and well-being of all San Diegans. If I can deliver a message from them, it would be, get yourself vaccinated, and don't forget to protect yourself from illness by wearing a facial covering, washing your hands, and maintaining distance from others, especially people who are sick. Now I would really like to introduce my colleague Rob Sills, the director of the County Medical Operations Center and the man who keeps all the hospitals stocked with critical supplies and staff. Thank you.
Thank you, Dr. Foster. As the director of the Medical Operations Center, my responsibilities are organizing and making sure that these events run without a hitch. And I cannot do that, as we said, without our dedicated nurses. We have over 30 nurse and ancillary staff here today to make sure that everyone is safe and we move through efficiently and safely. What you'll find when you get here is a socially distanced line where you can fill out the forms, and then you go immediately into a COVID symptom check. When you complete the forms, they're going to wipe that down for the next person, and you're going to move on to the influenza vaccine part where they're going to do some questionnaires, and then you're going to actually receive the vaccine and then head over to our influenza registry so that we can track demographics and we can make sure that we're reaching out to the populations that need to be reached out to. And as they said, we're going to have 6 of these events over the next 2 weeks all around San Diego. So please look on their website and make plans to come to one of them. My team also serves as the region's medical supply safety net, which means I stay connected with hospital executives and chief medical officers and asking them what do they need in order to keep their patients safe. They have 2 main asks right now. Number 1 is an adequate supply level, and that's an adequate supply level of our entire personal protective equipment. You know, that's what we've always talked about, the PPE kit and ventilators. The other thing they're asking for is hospital occupancy. They want to keep the hospital beds available when and if needed by a COVID patient. And one of the ways that we can do that is to offer up the flu vaccine to people so that patients with influenza will not be filling up those beds, may not be filling up those beds by having the flu shot. So for anyone who attends one of our 6 vaccination pods or points of distribution, you will find that it's safe and efficient, and if not, you can come find me and we will make the corrections. So I want to thank you today, and I want to turn it back over to our chairman, Greg Cox.
Thank you, Rob and Dr. Foster and Nick Massion for your comments this morning. Before we get into any questions you might have, I want to once again thank our public health nurses that are here today to assist people in getting these flu shots that are so vitally important. But also, in addition to the public health nurses, we have eligibility workers that are here so that we can sign people up for CalFresh or Medi-Cal or any other programs that are offered through the County of San Diego. So it's a real team effort. Our Health and Human Services Agency through Next Leadership has just done a tremendous job over the year in really implementing the Live Well San Diego initiative, which is trying to make sure that people are healthy, that they're safe, and that they're thriving in our community. So with that, we'll open it up to any questions you might have. Sure, go ahead.
I had a question, well actually have two, but my first one, I think the most important one, we've been adhering to all the recommendations to avoid COVID for the last 8 months. Do you think that might help lower the number of flu cases?
Well, I'm going to let maybe Dr. Foster respond to that. My guess as just a non-professional is that obviously if we can get people to keep wearing their masks and maintain that social distancing, to washing their hands, that's what we've been advocating for COVID-19. But obviously the same rules apply for influenza. But I'll let Dr. Foster, the professional, really give you the real scoop.
I don't have a lot more to add than what Chairman Cox had said about it, but we did see a decrease in flu when we implemented these guidelines back in the spring, so we do know there's a correlation, and we do believe that there may be a correlation or a strong correlation between the active adherence to wearing masks and social distancing, hand hygiene that are being done now, and the lower rates of flu that we're seeing this season.
Normally, how many flu cases would you have around this time of the year?
Oh, around this time, I can tell you for the last year what we had was the 20,073. I could get that information for you, though, yes.
Yeah, because we've been, like, everybody's has been adhering to these measures since March.
Sure.
So I've also noticed that people who have respiratory or allergy issues, even myself, like, we're wearing the mask and we're not sneezing that much. So it's helping.
Yes, thank you. Thank you for wearing your mask. Thank you.
Do we have another question here, Martha?
Oh, no, I just want to ask, how long it take to make effect the flu shot? How we gonna protect from the COVID?
Okay.
You mean how long does it take for the flu shot to be effective?
Be effective?
Oh, okay. Dr. Foster.
So our experts tell us that in 2 weeks, your body will mount the immune response that's needed to protect you against the flu. So about a 2-week period.
Thank you.
And obviously this year, because of the COVID-19, I think we've actually seen an earlier distribution of the flu vaccine and getting the word out to encourage people to get those flu shots as soon as they possibly can.
How many flu shots will we have all over the county with this program?
They mean the vaccines? How many shots will they provide?
Our team, to date, has received 55,000 doses, and we have pushed a lot of that out to our community partners and our public health centers, like the one that we're in the parking lot of today. So when the flu pod leaves here today, it's a 1 day only, the public health center will still be providing flu vaccines. So at the end of this 55,000 dose, at the end of November, early December, we have the ability to request more from the state and the federal government. And that's when we're going to go in and look at the demographics and find out where the need is and send teams out into those communities and continue this process.
Just want to add, one of the larger providers, healthcare providers, is Rady Children's Network Hospital, who does tremendous number of vaccines. And our events, healthcare providers all play a role. When I talked about the 1.2 million, I got mine at a pharmacy, retail pharmacy, okay? So we have pharmacies providing it, we have public health providing it, we have hospitals, healthcare, private physicians, our federally qualified health centers. And so we encourage people, if you don't know where to go, if you don't have a provider, call 211. And 211 has a network and will connect you to the nearest federally qualified health center or to provider where they're providing free flu vaccine shots.
What's the requirement for people? Because maybe we have some undocumented Mexico, even if they don't have any documents to be in the country legally, although they were brought to work here?
So folks that are in San Diego or San Diegans that are here, they can come to our events, and we will provide them the flu shot.
And there's no revision of the passport or anything? You just show
No.
up and get the flu shot?
And just like we have our COVID-19 at San Ysidro for people coming in, we don't ask for papers. We don't ask for that. We provide that public health intervention, which is what matters.
Thank you.
Thank you.
Clearly, our goal would be to have every person in San Diego County be vaccinated for the flu. That's an ambitious goal. We'll probably never get there, but we're never going to stop trying to get there. Any other questions? If there are additional questions, we can do one-on-one interviews. Thank you very much for being here this morning. Thanks.